We are here at the Prime Health Summit. It's an honor to be with Dr. Katie Richardson, Director of Innovations at the Colorado Kaiser Permanente Medical Group. Thank you for being here.
Sure. Thanks for having me.
I'd love to start with a little bit about your background. I always love talking to doctors. We call them doctorpreneurs at Startup Health. And one of the great trends we're seeing is the wave of doctors that are starting to focus on innovation. Maybe talk a little bit about your background and how you got into healthcare.
I actually decided as a junior in high school, of all things, that I wanted to be a pediatrician. And I was on that mission from then on, and I haven't looked back. So I'm a practicing pediatrician. I've been in Colorado for all of my training. And
you were at Children's Hospital?
Exactly. So
Colorado.
Children's Hospital, Colorado, went to CU for medical school, and went to undergrad down at Colorado College in the Springs. So I have been in this ecosystem for many years, and it's been really exciting to see things grow and change for sure.
So you really have been leading it for many years now, helping build the ecosystem here. I'd love to hear, what's your mission of what you're trying to accomplish?
So Kaiser Permanente's mission really is about delivering high quality, affordable health care to not only our members, but the communities we serve. Me personally, I am driven by the fact that being a provider is a physician is not an easy job, and especially with the addition of the electronic medical record, I really feel like so much has landed in the laps of physicians, and in order to kind of turn things around, I really feel like technology and innovation are what we need to leverage to take better care of our patients.
Are you optimistic about what you're seeing in terms of how innovation is helping improve or make some of the changes, or do you feel like geez, we've got a long way to go still?
I think we have a long way to go, and I'm very optimistic. I think it'll be the transformation, the turning of the tide is coming. The tidal wave really is coming, and I think it will really change the way that I practice. I predict in the next 5 to 10 years, I'll be practicing very different from how I practice today, which I'm really excited about.
Yeah, one of the things that I hear a lot from physicians that are focusing on innovation is the opportunity to get back working with patients again instead of paperwork and number crunching and bill paying and all those things that seem to be taking so much of the time out. Kaiser Permanente has been a leader in this area. Really, we're seeing the changing business models really from fee-for-service to value-based care. Talk a little bit about have you seen that work for you all, and are you excited to see more of the industry sort of follow your lead there?
Absolutely. Working for Kaiser Permanente, I can do what's right for the patient every time because I'm not incentivized to prescribe unnecessary medications, do unnecessary procedures, those types of things. It's really about, again, how do I deliver the highest quality care at the most affordable price? And that's utilizing evidence-based medicine to take the best care of my patients. And I'm very excited. I mean, I think our model is one that the rest of the nation certainly could follow in the value-based care arena. I certainly believe as a provider that it's the right way to go. I'm incentivized only to do what's right for the patient.
It's fantastic. This change can't happen fast enough. I know it does take time. Let's talk a little bit about Colorado. It's an extraordinary place for a variety of reasons. We're seeing it become really a leader with health innovation. Why is that? Why is Colorado such a great place? Why are more doctors and doctorpreneurs and entrepreneurs moving here?
Well, I think part of it is the culture and the people. It's a very open, welcoming state. So I think that's part of it. I think we attract a lot of young people who are really excited about, any kind of change and innovation. Healthcare specifically, we have, not only Kaiser Permanente, but University of Colorado Health and many big hospital systems, payers, and providers here in the state, which I think makes it a fantastic breeding ground for digital health technology and the change that we want to see as well.
What would some of your advice or lessons learned be to entrepreneurs, innovators that are just getting started here in this ecosystem and trying to work with the Kaiser, or I know many of the other organizations well? What would those lessons learned be and advice?
I think the biggest thing really is engaging providers and care teams early. There are some folks that go into digital health technology and health innovation that really don't know a lot about healthcare. And I think not only engaging providers and care teams, but also patients in what are their needs? What are the changes that would be beneficial? How could the technology that they are building or creating, how could that change the way we deliver care? So I think it's really engaging with both providers, care teams, and patients to understand where the big pain points are. And in partnership, in collaboration, we can definitely build something to work towards alleviating those pain points.
Predictions for the next few years. How does health change? What changes for the patient? Where do you see things going?
Well, I would hope one of Kaiser Permanente Colorado's visions is about meeting people where they are. And I really think that means virtual care is going to take center stage with how I deliver care for my patients, how we all deliver care for our patients. And I also think it's around, where are the places that you go on a regular basis and you would be able to get health care at all of those places. So meeting people where they are, both virtually and in person, I think.
In the home, at their work.
Absolutely.
In the park, perhaps.
Yes,
Yeah.
Starbucks, you name it.
Right, wonderful. If you could wave a magic wand and sort of enlist an army of entrepreneurs, a global army of health transformers, we call them, to help you on your mission or Kaiser's mission, what would you ask of them to help you with?
I feel like there are often barriers to trying to move this work forward. We're a large organization. Many of these collaborators or health systems are large organizations. So one of the things would be patient with us. Yeah. Don't just because it may not work out the first time or the first conversation. I would say no is just a starting point, right. and have patience. I get as frustrated internally as I know some of the entrepreneurs get frustrated externally. And like I said, we want to be involved and we want to be engaged. And so continue to reach out and ask for our advice and our assistance. And we'd love to partner and collaborate. That's
wonderful. And Kaiser Permanente Ventures has been a great supporter of Startup Health and our ecosystem. So I want to thank you all for that. Last question. Personal health. What do you do to stay healthy? Any tips for others? I really am about healthy eating. So I think it starts there. I, talk to kids in my exam room every day about healthy eating, active living. And so I think family dinners and eating healthy is at the core of that. And so I try and help my daughter understand that every day. And then we try and stay active. So, and really it's about she and I doing things together. So walking the dog,
going on bike rides, all that kind of stuff. Colorado's a great place to be outside, so we try and do that when the sun is shining as much as possible.
It's a beautiful day out today. I'm ready to jump outside myself. Well, thank you so much for everything you do, and thank you for sharing your wisdom with us.
Yeah, thank you.